Welcome, ladies and gentlemen. You are listening to the African Experience, and tonight you are joined by Mercy and I. I am the technical producer for Bold Moves Radio. Our hosts for today are not present, but I'll be leading this as a guest host. And tonight we have a very special guest with us. We are joined today by a very exceptional man. We are joined by Dr. H.J. Maluleke, who will tell us about his journey and his life tonight. And welcome, Dr. H.J., to the African Experience. Please greet our audience and tell us who is, and also tell us, please, who Dr. H.J. Maluleke is in a nutshell.
Good evening to you, and good evening to our listeners and those who are watching and listening. Yes, I am Dr. Hlengani Joseph Maluleke. I would regard myself, or I think I'm a simple guy. I was born many years ago in a small village in Mukopane, where I grew up. And like all the village boys, I was a head boy myself, taking care of the cattle and the goats and the donkeys that my family owned. And I went to a normal school at the village there. In those years, there was just one school in one village, and all villages surrounding that area used that school. So we went to that school, and the name of the school was Pastor Spark Primary School, where I did my primary education. And then when I finished my primary education, I was informed that I had been the top candidate in the whole of the then Leboa homeland, in which case then the second in that area decided to now take me to a boarding school, because they thought I would be distracted by the usual village kind of life, heading the cattle, going to play soccer, going to hunt, things such as those. So they wanted me to go to a boarding school where I would not get the distractions as they thought at the time. And I found myself at a school known as Nakonkweto Secondary School. When I got there in 1979, they were just introducing standard 9, because it used to be just the secondary school. And in that year, when I went to that school, boarding school, they were introducing standard 9. And so I was there in that year when I was doing standard 6. And we came back from the winter holidays. I was informed that I needed to go to the next class. So I did my standard 6 and standard 7 in 1 year. And then the following year, I was in standard 8, which is Form 3, then Form 3. So we wrote our exams, and when I came back to get the results, I was also informed that I had done well, and therefore I'm being given a bursary to go and study my matric at the then Setutulwane College of Education, which is situated almost about 30 kilometers west of the city of Polokwane, which is where I did my matric. And when I was there, because this was a school that was selecting highly exceptional students, the competition was so stiff. Up to that point, I used to be top of the class every time. But then when I got to this particular school, I really met guys that were, they were good.
Yeah.
But then it created a lot of competition amongst ourselves. The good thing about this particular school is that we had 2 classes of matric of 30 students each, and every one of us was studying mathematics and science. So we and all the subjects were in higher grades. So we We studied there, and when I got to standard 10, which is now grade 12, and it was time for us to decide where we would want or what we wanted to be. Up to that point, I had actually thought I would study pharmacy, which was offered at the then University of the North. But then we had this thing in those years, which was known as the Youth Science Olympiad. And at that school where I was, everybody entered this, and the top candidate in the homeland, all the homelands were participating, including the then Transvaal administration. If you were the top candidate, then you would win a trip to go to London and spend two weeks there. So for the 2 years that I was there, I wrote this Youth Science Olympiad, and I had in both on both years I qualified. I did not qualify to go to London, but I had reached a minimum that allowed us to be taken around the country to go and see places of interest as far as science was concerned. For example, in 1981, we were taken to the then University of the North. Then we went towards the ferrochrome to go and see how mining was done. From there, we were taken to the CSIR. We went to Sasol. These were some of the places where we were taken to go and talk. Now, the following year, when I was in grade 12, one of the places that we went to was the Medical University of Southern Africa. Up to that point, I never thought I could go and study medicine because we were informed that this was a near impossible course to do, where you were not allowed to fail. If you fail, you get excluded because failure was equated to having killed a patient. This is what we were told. But until that point, then I got to the university. What surprised me was that I actually found guys that were a year ahead of me in matric. Those, when I did standard 9, they were in standard 10, and I found them there, and I said, but then this thing is possible. If these guys are here, it means I can also do this. And then I actually applied, and I was admitted to the university to study medicine. And fortunately also because the year when I was in matric, my father, who was a pensioner, passed away. And then everything had to change in the household. But I was steadfast, thinking that even though now we won't be having any income in the house, and quite a number of my relatives were saying, now that your father has passed away, it means you need to go and work after matric. But that is something that got into one ear and got out the other ear. And I had applied to a number of bursaries, and I was fortunate that the then homeland gave me a bursary to go and study medicine because I had passed fairly well. And that's how I got to the medical school. And fortunate also was that bursary also came with a stipend. We used to get a 200 Rand monthly stipend, which was to take care of our daily needs and so on. So, and that's how I got to medical school. And because, like I said, this particular school where I matriculated, we were doing science. There was quite a number of us from that class that went to the medical school. I think there was about 8 of us that went there to study medicine after we had passed fairly well our matric examination. And so for the next 6 years, I was at the medical university studying medicine, and I finished my studies and went to work. I did my internship at Groote Hospital, which is situated in the Zebediela area. After my internship, I went and worked for 2 years at the then Mankweng Hospital, which was a fairly new hospital, very beautiful indeed at the time when I went there. And when I got to Mankweng Hospital, I was based in the obstetric and gynecology section. For the 2 years that I was there, I was the one running that service. And this is where the love, besides the fact that I was highly impressed by the then professor of obstetrics and gynecology, who was, he presented his matter very, very well, and made a huge impression on some of us. Professor Mokhokong, and he's now a retired professor. He had actually taught a lot of us. If you walk around the country and you mention his name, you will find that he's one of those people that had taught a lot of students to study medicine. So he was one of the people that impressed me and made an impression, and I actually wanted to be like him. So I got to medical school and then studied. And after that, 2 years later, after finishing when I was in Ngwenya, I had to make a decision. And the decision was between staying in the hospital and worked as a medical officer, or went out and opened a practice to be a general practitioner, or go back to school. And I decided on the latter. I decided, let me go back to specialize. And I got admitted again at the Garamkua Hospital, Medunsa. This time around, we were working under Professor Marivati. May his soul rest in peace. A very good teacher indeed, also, who was the same peer group with Professor Mokhokong. They studied together, they were together in Natal, and the two of them made me who I am today. And Professor Marivati took me under his wing, and when I got there, I was under his unit, and he's a man that had published a lot of literature and papers on multiple pregnancy, and that is a subject also that I got to love. I like twins, triplets, and that kind of pregnancy. That is, I even wrote my research on that. So I then studied another 4 years to become a gynecologist. And at that time, I was also lecturing. And I also discovered that I loved teaching. I liked teaching. And I continued doing that even when I came back to the province. I was teaching medical students. I taught a number of people who are now specialists. We trained quite a number of them because this is something that was a secret passion of mine. So I continued doing that. And it's not surprising that even to this day, I still do a lot of lectures, if you like, or teaching on radio and even on social media. I write quite a bit on enlightening people on matters like this. But it also emanates from what my father had intended for me, because when I was in matric, I got to sit down with him and he asked me, now that you are in matric, what are your intentions? And I told him I want to go to medical school. After a bit of silence, he said, but do you think we will have money to study to pay for this? I said, no, if there is money to pay for my first year, I think that will be sufficient. Then he says to me, but the school you are at is a teacher training college. I said, yes. He says, why don't you do teaching? So I realized that he wanted me to be a teacher. So when I went to medical school, I wanted to satisfy him. Well, I satisfied myself by studying medicine, but I also became a teacher at the same time. And I think I was fairly good in the teaching aspect, to a point where the year when I left, the medical students of that year gave me an award to say I was the best lecturer to the undergraduate students. I have a certificate in my office. If you came there, you'll find it there. So I like teaching, whilst doctoring is what I do, but I also like teaching. I enjoy them both.
Wow. Thank you so much. And you've mentioned a number of people on your journey to studying medicine. And I would just like to clarify, what inspired you to take up the path of medicine and specialization? Because you mentioned your professor, you had mentioned even your father who you went to teaching for, but your heart was still with medicine. Who or what inspired you to truly take this path to gynecology and obstetrician?
Well, like I said, you know, when you are at medical school or any university for that matter, you've got a lot of lecturers,
Mm,
and some of them are very good at what they do,
mm,
and they make an impression on the students.
mm,
Over the years, from first year up to final year, we were meeting all these professors. But like I said, the one that made the most impression on me was Professor Mokhoko. And I actually then loved the subject, even as an undergraduate student. But also because in those years when we were students, we never used to spend our holidays at home. Every time we were on a holiday, we would go to hospitals. We spend
mm,
our holidays working in hospitals. And this is where we then started learning the techniques. We were delivering babies. We were um, um, taking care of children that came being sick, children with fractures. We were doing a number of procedures. And during that time, the area which was much more eventful and interesting for me was the maternity section in any hospital. That is where I
mm,
enjoyed my work most. So all these things cumulatively influenced my decision to go and specialize in obstetrics. So there was no question about it. Obstetrics
mm,
was my first choice. The second choice was pediatrics. If I couldn't get a space in obstetrics and gynecology, I would go and study pediatrics. And my third choice was anesthesia, which is the specialty where we put people to sleep when they go
mm,
and undergo an operation. So fortunately, when I applied for my first choice, I got the post, and the others fell by the wayside. So I was able to go and specialize in obstetrics and gynecology.
wow. Wow,
Yeah.
beautiful. This is beautiful. And it has been brought to my attention as well that through your love for lecturing, which you came to find as you were studying for medicine, but also teaching, you have also created an online program where you share your knowledge and information to people. Please tell us about this program and what exactly it is that you share in these programs.
Well, this is a radio program on a local community radio station
Mm,
in Polokwane,
okay.
where on a weekly basis, on Wednesday, on Saturday, on well Thursdays, at 19 hours 30, I go there, and we discuss matters that pertain to women's reproductive health,
Mm,
and it is called Women's Health. So we go and talk about anything and everything pertaining to women's issues
mm,
as far as reproduction is concerned. Now, now that this is a radio station which has a limited reach, it reaches a
mm,
particular, it goes as far as a particular radius. But then I then decided, in order for me to reach a larger audience, I would then stream that particular program live on my Facebook page. So
mm,
every week I then stream live, and there are people, some of whom are in Gauteng, others are away. Like my daughter is in Australia. She's
mm,
able to tune in and get to hear me speak about these issues. So then
mm.
I reached a larger audience rather than just leaving it at the level of the radio. So that is the online, if you like, online program that I'm having that reaches quite a number of people. And those videos are also saved, and anybody who would like to access them, they are there on my Facebook. You can go and watch them. I've been doing this almost 5 years now. And it is a program where women are given their latitude to ask anything and everything. In the past, when we started the program, we would have a topic for the day. For example, I would have decided that today we're talking about infertility. All right. But then I realized that there were many people who will phone in and ask about other issues that were not related to the topic for the day. So then that opened my eyes to say, no, instead of us restricting the discussion, let's open it up. Let's allow people to ask about anything and everything that concerns them. So that is what we are doing currently. They ask us about everything that is bothering them, and I believe we're able to fairly address their concerns.
Wow. Thank you so much. And to my listeners as well, if you have any questions on that note to ask Dr. HJ as well, please send your questions to the following number, 069-581-8597. I'll repeat the number once more, 069-581-8597. Or please leave a comment on the comment section and I will address it as follows. And back to you, Doctor. You chose a theme for tonight as the show normally allows our guests to choose a theme. And your theme for tonight was Women Matters Matter. And I can see as well as you've answered with your program, you dedicated a program and you've tried and you've been reaching out, in fact, across the borders so that women are given an opportunity to reach out and ask anything and everything pertaining to women's health and the reproductive system. Now, with this specific theme in mind, why did you choose this theme per se, and what does it mean for you and the work you do?
Well, this is simple. It is simple because without women, we won't be having any of the things we are having. Let me speak about medicine, for example. You know, in medicine, we've got a lot of disciplines or specialties. You've got pediatrics, you've got internal medicine, you've got surgery, you've got orthopedics, you've got neurosurgery, cardiology, cardiothoracic surgery, anesthesia, psychiatry, and so on and so forth. But without obstetrics, you will not have any of those. It has to start with pregnancy. You need to have someone being pregnant and give birth to a child. This child then becomes a patient to the pediatricians. This same child can also be a patient to the orthopods. This same child will grow and have a surgical problem that will need a surgeon, and so on. So it has to start with obstetrics. Without obstetrics, you cannot have any of the things that we have. We also make sure that teachers have children to teach. Okay? We are the ones that will make sure that this child is born safely and this child is not affected mentally and this child has a good cognitive function so that when they get to school, they're able to understand and comprehend what is being taught. It all starts with the obstetrician. So therefore, the women matter. They definitely matter, and we have to take care of the women so that we can enable all the other things to fall into place. If we don't take care of them, then we are doomed as a people. So that is why my theme says women's matters matter. We have to make sure that we have women that are healthy, women that are taken good care of, women who can have healthy pregnancies, give birth to healthy babies. These babies then grow to become adults that are useful in the community. So definitely, women's matters matter. I will not have any doubt about that.
Very true, Doctor, and thank you so much. And
besides, this is Women's Month. Okay,
yes,
it's Women's Month. The whole month is dedicated to women. Therefore, it is very apt that we address issues pertaining to women, particularly in this month of women.
Yes, very true, very true. And we have just been jumping around gynecology and obstetrician, but there could be someone out there who is not too familiar with the terms. Can you please explain what these two specialists do and where in what field they necessarily work with? I'm sure there's an understanding now that it's with women, but for someone who says I've never heard of an obstetrician or this is the first time they're hearing of that term. Can you please
Yes.
explain what these two specialists do and in what area?
Yes. I'm glad that you are saying there is two in one. We're actually two specialists in one. There is an obstetrician and there is a gynecologist. All right. And there is a move now
Yes.
in certain quarters to separate the two. And there are people who have then decided, look, I will only want to, even though I'm an obstetrician and a gynecologist, I only want to do obstetrics. And there are those who say, no, I don't want obstetrics, I want to do gynae. What are the differences?
Okay.
Many people will claim to know gynecology and not so much obstetrics. Gynecology has to deal with women's issues that may not be pregnancy related. But we do when we take care of a woman who's pregnant that is below 20 weeks of pregnancy, all of that is regarded as gynecology, right? So if you come and you are maybe a month pregnant or 2 months pregnant, up to 5 months, that is the side of gynecology pertaining to pregnancy. After 20 weeks of pregnancy, that is obstetrics. Now, obstetrics is purely dealing with pregnancy and pregnancy only, all right? Or pregnancy and childbirth. Whereas gynecology deals with all the other problems that may not be pregnancy related, such as contraception, such as fibroids, such as fertility, such as menopause, such as cancer, all those that affect the female reproductive organ is the gynecology part. It doesn't concentrate on pregnancy. But obstetrics, it's the care of a pregnant woman up to the point of delivering that baby. That is the obstetric side of obstetrics and gynecology. So when she comes and she's pregnant, we see her at the antenatal clinic, we take care of her until she reaches the end of that pregnancy. Then we also plan on how we're going to deliver the baby. Is this going to be a natural birth? Is this going to be a cesarean section? What are the reasons for that? Then that is the obstetric side of things. Now, obstetrics, because it deals with mother and baby, right? There are two patients there. It is the mother and there is the baby.
Yes.
When we say things have gone well, it is when you have a mother that goes home with a baby that is well.
Yes.
Then we know that we have done well. And we can only say that in retrospect. We cannot predict. We cannot tell this mother that, no, you are going to deliver this baby. Your baby is going to be well, and so on and so forth. We can't tell in advance. But when she delivers a baby and she goes home tomorrow with a baby that is well and sucking and is moving nicely, the central nervous system is intact, then we know that the obstetric side was okay. We have done well, right? Now, it is regarded as a very high-risk area of medicine. Very high risk for the reasons I've mentioned, that you are taking care of two patients, and you must also always make sure that the outcome is good for both. This is why the level of litigation, for example, an obstetrician, or let me say, doctors have to take insurance to indemnify themselves against possible lawsuits.
Oh, yes, yes.
Did you know that the obstetricians are the ones that pay the highest premium of all the disciplines in medicine? We pay much more premiums for indemnifying ourselves for in case things go wrong. So we are actually very high risk. But the disappointing thing about it is that we don't get paid that well. You know, if you look at the loss of economy, they will tell you that anything that is any investment that is high risk, right? If you put your money in a high risk investment, then the returns are good, isn't it?
Yes.
Yeah, if you put money in a high risk investment and that investment performs, you are going to get good returns.
Yes.
But the high risk investment also means that there is a higher chance you can lose it all.
Yes.
All right. So people who get involved there, they know what is involved. But with us, we don't get paid that much, even though we are regarded as people who are doing a very complicated, high risk procedure, taking care of a mother and a baby and ensure that both of them are well. We don't get paid that much. Okay. And that is the sad part about it. And because of this, it is discouraging a lot of younger people to go and specialize in obstetrics, to say, but why must I take all this risk when the returns are not so impressive? Why must I? Because people will sue you at the drop of a hat, but they don't pay you very well if you have done a good job. Makes you wonder that what is the value of life? Is life valuable when it is damaged? But when life is good, we don't value it. If I have done a good job and things have gone well, I would expect to be paid better. In the same way, if I don't do well, you can sue me, we accept. But you are going to pay me 2,000 rent for a delivery, but when things go wrong, you want 12 million. Doesn't make sense.
Yeah.
Doesn't at all. But that is the obstetric side of things. And because of that, there are people who say, but why must I take the risk? There are many in this country who have decided they are no longer going to take care of pregnancy. They'll just see women who come complaining of period pains, women who complain of hot flashes, women who say, I bleed heavily when I menstruate. They only take care of this. Once you're pregnant, go next door. I cannot see you because of this problem that we're faced with. Just to give you an example, do you know that currently, as we're speaking, we've got an organization that is known as the Medical Protection Society, MPS, which is based in London, where we pay our insurance premiums. The current insurance premium is per annum is 1 million, 1.5 million. Right? And you must pay this premium over a period of 10 months. Right? 1.5 million. That means every month, 150,000 rand must go towards servicing insurance. Now, if I have to spend that kind of money, how much money am I making? So that I can afford to pay 150,000, a single amount every month of 150,000 must go towards indemnity. How much money am I making? What about the other needs? So for that reason, many people are now saying this obstetric thing is not worth. So we'll probably face a problem a couple of years from now, unless things change, of course. We'll face a problem where pregnant women might not have people to take care of them. They will have to be taken care of in government and no longer in the private sector. I don't know how the NHI is going to work, and if it does, maybe it will sort out some of these problems.
Yeah, no, those are some very serious issues you've mentioned. And Dr. Maluleke, to someone listening right now and saying, they've heard what you've mentioned, the high risk that comes with this job and the payment not being enough, and the even higher risk of something going wrong and being sued. What can you say? What possible solutions can society and even government look at to try and counteract these issues that are being brought forth, not only with certain patients now being at risk of not getting help, and also the doctors themselves not having enough ground to protect themselves also in terms of insurance, because the premiums themselves are also demanding more than they have.
The problem is that when something goes wrong, we're very quick to blame. Very, very quick. I mean, it's not only in medicine. We can see it even in situations where someone dies in the community. When someone dies, we want to see who is involved, who has killed this person.
Yeah.
When we know that illnesses are there, we do have diabetes, we have hypertension, people will have this condition and they will die from them. It's not always witchcraft that is involved there. Now, with medicine, for some reason, people think doctors are demigods. They can do all sorts of things. Nothing should go wrong in their hands. And therefore, if I have a patient and something goes wrong, people are very quick to think there was negligence. Now, I always tell people that my practice, my line of work is similar to you getting into a car every day, driving a car to a particular area. If you come and we say to you, you've got a condition that needs an operation, all right? And you've got concerns. And the question is, will I wake up, doctor? Is this going to, what is going to happen if I undergo this procedure? And then I ask, okay, what did you use to come and see me today? How did you come here? They say, no, I drove here. And I say to them, do you know that by merely getting into a car, you are putting your life on the line? How did you know that we're going to reach this place? Did you know that you were going to reach my place and you'll be able to drive back home safely? He says, no, I didn't know. And I say, this is exactly what happens when we go and operate on you.
Yes.
We believe that the operation will go well. But in the course of doing the operation, there are things that can happen, and we regard those as accidents. It is not always due to negligence. In a similar way, you can drive a car and be involved in an accident without having made a mistake yourself.
Yes.
Isn't it?
Yes.
You can actually have a serious accident without having caused any mistake or made any mistake, and yet you were in an accident. But when it's the car that is involved, everybody says, no, it was an accident. But when it is the doctor, no, he's negligent. And we will hit him hard. Now, I want to concede that there are instances where negligence is taking place. People don't follow the protocol, they don't follow the norm, and things go wrong. We agree.
Yes.
But none of us wakes up in the morning going to work having planned to go and cause harm on a particular person. We don't do that. We all go to work, and it is in our nature as doctors to expect good outcomes. When things go well, I am happy. I am thrilled. I have done well. This is in our nature. If things go wrong, and people may not believe this, it is very hard on us as doctors. That how did this operation end up this way? I did this operation, and now look, it hits very hard on us. But people don't believe. They think we are money mongers. We are just chasing the money. We don't care. And that is far from the truth. Doctors are, in their nature, people that would expect things to go well. If they go well, I'm happy. I will be singing all the way home to know that I have done well on that patient. You know? So we don't plan these things, but South Africa is at the moment, we are at the level where United States of America was a couple of years ago, where lawsuits were left, right, and center. People were being sued even for just missing a vein when you go and draw blood there. If I don't get blood first time around, they say I've assaulted you, and they will take action against you. So people are now practicing defensive medicine, which is why they will do all sorts of tests, some of which are not necessary, because they want to protect themselves. To say, no, I've checked this, I've checked that, and so on and so forth. Some of the things that are done are not necessary, but people do them because they are afraid that if they don't do it and something goes wrong, they'll say, why didn't you do this? And yet, that is something that may not happen in a lot of instances. But because we want to practice defensive medicine, we end up doing unnecessary tests. And that costs you money.
Yes.
Right.
Thank you so much, Doctor. True. It is truly not in the hearts to come and as you've stated, to cause harm, but it is essential to know these things and not play a blame game. And I
But you
see
see,
also
yes.
I
But
see
part of
also
the
our
reason, okay,
listeners
yes, you can talk.
are saying, I see Matudis Chuma saying great, and Deborah Struggle saying wonderful story, doctor. And Lorraine Sikoa saying thank you for your exceptional care and for always putting your patients first. You are truly appreciated, doctor. What an inspirational story. I see also Rulani saying great teachings, doctor, most appreciated. And Dolly Mhlari saying her greetings, and Disiba Betty saying I am on it. And Charity Nwamvuleni also greeting and saying evening family. And sorry, I once more for the interruption, but I see appreciations coming in from the listeners to say that your story is very inspiring and it is touching the many of. And please continue with your conversation.
Okay. Yeah. I was saying part of the reason why doctors get sued by patients, it's often because of poor communication. They don't communicate very well. The patient that says, look, Maluleke is my doctor. I've been with Maluleke for years. I know what he's capable of. If something goes wrong, the patient will know that no, my doctor has done his best. It is just one of those things. But sometimes we doctors, when something goes wrong, we want to be on the defensive, and the patient can actually see that, oh, this man is now trying to avoid certain things. But if you as a doctor go and sit down with the patient and perhaps with the relatives, and you explain what has happened and why it has happened, sometimes in most instances they'll say, ah, doc, look, it's one of those things. There is no issue. But if we don't communicate very well with our patients, then we are opening up avenues for litigation.
Yes.
Yeah. But I have been in this field for many years. I have had very wonderful experiences with my patients. I have had a few patients where things could have been better, and some patients even passed away, by the way. And this is true for all doctors, that you will encounter situations where you lose patients and patients die in your hands, and you wish things could have been different. Yeah, but in the main, largely, we are having a situation where many patients come, many patients get helped, and they go home and they are happy, and and life continues. And this is what most of us go through as doctors. And that is the rewarding part of the work that we do, not even the monetary side of things. Yes, we are doctoring, but we're also in business. And sometimes patients don't understand that this man is working here, and this is the only area where he is working. All right. And his services need to be paid for. All right. I need to pay him. You know, the question of medical aids have clouded the picture somewhat. That when you come to me and you give me your medical aid, do you know that I am doing you a favor by submitting the claim to your medical aid. The correct thing to do is for you to pay me, and I give you the invoice to go and submit to a medical aid, and they reimburse you. But we then take the medical aid, we submit it to your medical aid company, and we hope we will get paid. And a month later, when you are cured and you are well, the medical aid rejects the claim. And when they reject the claim and we call you and say, hey, your medical aid hasn't paid, then you say, but why? Why has the medical aid not paid you? And then they say, no, the doctor didn't do this. The doctor didn't, which is the trick they are using, not to pay the doctor. So patients need to understand that the agreement is between the doctor and the patient, not between the doctor and the medical aid. It's actually illegal to be giving you a service and expect a third party to pay me for the service I have given you.
Yeah.
It's not supposed to be that way. But, we then allow it, and it's going on. Medical aids are a law unto themselves. For example, do you know that medical aids will not pay if you came to consult with your infertility, for example? You are not able to have children. And you come and say, Dr. Maluleke, I've heard you can help people. I have this challenge. Medical aids simply say, no, you are not sick. We will pay when you are sick. Infertility is not a disease. They say so, right? And people allow this. They allow this sort of nonsense to go on. You give them your money, and then they decide, no, you can't spend your money this way. You can't. We are the ones who determine how your money is going to be spent. And because the medical aid saying so, there are people who say, the medical aid says so. Who's the medical aid? What money are they talking about? The money they are talking about is your money. It's not the medical aid money. All right? They need to listen to you. All right?
Yes.
Not the other way around. They are administering your money. And then they also decide you can no longer see Dr. Maluleke. He's not on our preferred provider list. You can go and see Dr. So-and-so. And patients allow that sort of thing. When Dr. Maluleke has been your doctor for years, because now your medical aid wakes up and says, no, we're not. And Maluleke has not done anything wrong, by the way. They just decide, no, he's not on our list of preferred providers. When you are sick, go and see that one. Don't go to him again. Fortunately, I have had a few patients who challenged that thing and said, no, I'm not going anywhere. Dr. Maluleke is my doctor. He knows my story. You are going to pay him. And the medical aid pays.
Wow.
Patients don't know these things. They think medical aid is a law, and they are not a law. They administer your money.
Yes.
And you must be able to have a say on how your money is to be spent.
No, that's very true. And I can see also one of our listeners is saying, thank you for a lesson. May the good Lord bless you. Truly speaking, you've even brought insight to how medical providers also are not law, as you said, but simply you must administer payments and make sure that you take the payments you have made to the provider so that they might reimburse you. You have truly opened, I know you've opened the eyes to so many that were not aware of this. And
yes.
Doctor, if someone was to say that they would like to further get in contact with you after this talk, and they're saying they would like to ask questions or maybe book an appointment, where can these people find you?
Well, I am based in Polokwane.
Okay.
The office is at 72A Compensati Street, or you can say corner Jorison and Compensati Street.
Okay.
The number there is 015 295 9407 or 295 9419. That's where we are based. And I admit my patients at the local Mediclinic. That's where I do my deliveries and do my operations. All the patients that I see, and I see patients from almost from the whole of the province. Patients from as far as Musina, Malamlele, Begersfort, Mukopani, Mokopong, up to sometimes even Ellisras. They all come to Polokwane to be attended to there when they need operations and they need deliveries. On alternate Fridays, I consult at Folang Medical Center in Mukopane, number 31 Reiter Street, every fortnight on Fridays only. The rest of the time, I am in Polokwane, and I'm there on Mondays, on Tuesdays, and Thursdays. Alternate Fridays also. But Wednesday, like tomorrow, I will be in theater. It's my theater day. We're going to be delivering babies there. We're going to be doing other operations. So if you come on Wednesday, you will not find me. You will only find the staff there because we are in theater on Wednesdays, every Wednesday.
No, thank you so much. And just once more, may you please repeat the number for those in case who have missed it?
It's 015-295-9407 or 295-9419.
Thank you so much, Doctor. And I see again another comment from Mathudis Chuma saying this is really enlightening, and truly speaking, it has been an enlightening talk and an eye-opener, I am sure, not only just for me, but for the rest of the listeners. And wow, time truly flies by. I see we just have less than 10 minutes left, but I truly wish we had the whole day because this is truly an inspiring talk. And just as a reminder, as we're celebrating Women's Month, what message do you have for women out there and who might listen today, who are listening today, who might listen tomorrow, who might listen in the future? What message do you have for women who are listening or who will listen?
Right. The message I really, really want to get out there is for the women to take care of themselves, to pay particular attention to areas that are important when it comes to their health. And here we're talking about preventive medicine. We are talking about screening yourselves for a number of things. And for that, you only require one visit per annum to go and see your gynecologist. Just one visit. You don't have to be seeing him every month. Well, unless you are pregnant. But if you're not pregnant, make it a point that at least once in a year, you schedule an appointment to go and see your gynecologist. And you come and say, I am not sick. I'm just here for my annual checkup. What will the doctor do? The doctor will check your blood pressure. They will weigh you. They will examine you. In the examination, they will do breast examination. They will do an ultrasound to look at the internal organs. And they will also perform a pap smear. All right? Now, I must zoom in on the two areas, namely the breast and the cervix, because these are the two organs that account for the majority of cancers in females, right? If you take South African women as a group, all South African women of all races, when we look at cancer, the number one cancer is breast cancer, all right? But if you zoom in on the African women, the highest cancer they suffer from is cervical cancer, right? Now, the good thing about cervical cancer is that it can be screened for. This is also true for the breast. Now, if you were to go and have your annual pap smear. The purpose of doing a pap smear is to prevent cancer, not to diagnose cancer. Because if you do a pap smear and we pick up cancer, it is too late. So you do a pap smear so that we can see changes that precede cancer. And these changes are slow progressing changes so that we can catch those changes prior to them becoming cancerous. And when we treat these changes, we do so with the intention of preventing cancer. In countries where women are being screened this way, there had been a dramatic reduction in the incidence of cancer of the cervix. In our country, we still see a lot of women who will present with advanced cancer, which is a great pity. We shouldn't be seeing this kind of thing in this day and age, particularly because in the government sector, some of these services are free. If you say, I cannot see a gynecologist, I don't have money, you can go to a local clinic, you can go to a hospital and ask them to perform a pap smear. You won't be paying for it, except maybe to pay for opening the file. But that service is free in the government sector. But assuming you are worried about the cost of a pap smear if you did it with a gynecologist, the pap smear, if you pay cash, well, you'll pay the consultation fee for seeing the gynecologist. But the pap smear costs less than 300 rand. If you have that, you spend that kind of money once in a year, surely this should not be prohibitive. That is the one thing that I need to emphasize. Who must be screened for cancer of the cervix? We are talking about women from the age of 18 who are sexually active. These women must have at least one pap smear annually. If you have had 3 pap smears consecutively that are normal, then you can even skip a year after that and do it another alternative year, because it's unlikely that you can develop cancer and it progresses over a period of a year. It's already advanced. It's very unlikely. If the pap smear is normal this year, next year when it becomes abnormal, it may still not be cancerous. So this is why we would say once in a year, have a pap smear done. And if you are older than 40, you must have your mammography, which is screening for cancer of the breast. This cancer is starting to be much more commoner in women older than 40. But if you have a strong family history, and by that we mean if you've got first-degree relatives that have had cancer of the breast, who are these people? We are talking about your mother, we are talking about your sister, we're talking about your granny from your mother's side and your aunts from the mother's side. If any of them had breast cancer, then screening can be started a little bit earlier from the age of 35. But if you don't have a family history, then 40 years upwards, that's when you can be screened. The reason for that is the screening of breast cancer is done using radiation. So if you start earlier, you get exposed to radiation repeatedly, that by itself may put you at risk of developing cancer of the breast. But if you've got a family history, it's a question of risk and benefit. We see that if you don't get screened, the risk is a bit higher. So the benefit is good. You've got a better benefit if you get screened than avoiding it, because your history is a bit strong. Now, that also is an important aspect in women's health: breast cancer screening and cervical cancer screening. And going back to cervical cancer, we also have a vaccine that is available, which you can get over the counter. This vaccine is directed against viruses that are known to be the ones causing cancer of the breast, because cancer of the cervix is now known to be a sexually transmitted disease. You get it from sexual activity at which you get infected by or with the human papillomavirus, the virus that usually causes warts, is now known to be the culprit in causing cancer of the cervix. So now there is a vaccine that is meant to prevent this kind of infection. And the government had given a directive that young girls who are in grade 4 must be vaccinated routinely against this. I know that there are people who have got certain views with regards to vaccines, but speaking from the medical point of view, vaccines have been shown to be very, very, very effective in combating illnesses. For example, there are people who no longer know a disease known as smallpox.
Yeah.
Smallpox was a disease that was there over the years. It has been eliminated because of vaccination. Polio. We no longer see people getting polio because there was a mass program to vaccinate people against polio, and we no longer see that. We were almost at the verge of eliminating measles, and that is because of vaccination. So vaccination works. And if we were to vaccinate these young girls as early as grade 4, and you catch them before they are sexually active, we will see the benefit a couple of years down the line when we now see a reduction in the incidence of cancer of the cervix. So that is the other side of this whole issue, that whilst we can prevent it by screening, we can also do so by vaccinating young girls. But even women who may not have been infected with the human papillomavirus can still go, and they can get this over the counter. If you went to any chemist and say, I want to be vaccinated, they will give it to you. You only need 3 doses of that vaccine. You get one now, and then 3 months later, you get the second dose, and 6 months later, you get the last dose, and you are protected against cancer of the cervix for life. That is perhaps the most important point of this talk tonight, that we can prevent this disease. We shouldn't be seeing the kind of cancers that we see in South Africa with the kind of resources that we have. We shouldn't be. Yeah.
That's true. Thank you so much. Time really flew by, but I would like to show my appreciation to you, Doctor, for coming on this show and sharing your knowledge with us. And once more, I see even comments are saying from Mapula, she's saying, wow, very informative. Thanks, Doctor. We'll definitely go for an annual gynecological check. And Shongi is saying, thank you, Doctor, for an informative session. May God bless you. And so much more appreciation. And once more, Doctor, thank you so much for coming on to this show. And I would like to give you a moment to give just a parting shots to say bye to the listeners as you bid us farewell.
Yes, for those who are listening, thank you very much. Hopefully, this was useful. It has empowered someone. We may have given you something that you did not know. And that is the whole point. The point is to empower our people, give them information, and hopefully they will use it appropriately. Because there are people who get information and they don't take the necessary step. It's a great pity. Because we see that every day. I mean, young girls, young people today are exposed to this kind of information, but their behavior does not seem like they have seen or heard anything with regard, say, unwanted pregnancies or teenage pregnancy, or even young people getting infected with HIV. They are told that if you have unprotected intercourse, you run the risk of being infected. But they would still go and practice that. And then they get shocked when you test and you find you are pregnant and you're only 16. Shouldn't be happening. That means you get information and you don't use it properly. I usually say there's a difference between being learned and being educated.
Yes.
An educated person is the one who goes to university, acquires multiple degrees and diplomas. But a learned person is the one who does that and utilizes the acquired information to modify his behavior. That is why you'll hear people saying, ungene isikolo mara angadondekangi, or utseni isikolo mara asiarutei. You know, because you have degrees, but your behavior does not show that you are a degreed person.
Yeah.
You are not learned. You're just educated. And there's a difference. So hopefully people are learned today, not just educated.
Yes. Thank you so much, Doctor. And also to my listeners, a very big thank you for coming on to the African Experience. You are joined today by your guest host, Messi and I. You'll be with your hosts most likely from next week. And I would also like to give thanks to my executive producer, Pastor Strike, and once more to the hosts for this opportunity. Thank you, Dr. Hlami and Miss Aventina. Ladies and gentlemen, just a quick shout out before we leave. On the 17th of August, in celebration of Women's Month, we will have our annual Limpopo Gospel Divas concert at Farm Life Gardens from 9:30 right here in Polokwane. If you are around, please do not miss this, as we'll be celebrating with our gospel divas, and it will be a day to remember. And this year there's been an addition for gospel awards. Please come, and the attire is all white with your colorful duke. Thank you so much. You have been listening to the African Experience with me, Mercy and I. And as the saying goes, the African Experience is telling African stories the African way and taking Africa to the world. Thank you so much, and God bless.